Hi there, everyone. I am Pam Yankeelov. I'm the Director of Research and Evaluation at the University of Louisville Trager Institute. And in partnership with the Kentucky Coalition for Healthy Communities, we welcome you to Project ECHO, Care of the Older Adults. And just a little technology tips. We ask that you go on and turn on your camera so we can get to know everyone in our learning community. Check to see if your mic is working, and you can just go on and do that by testing it using the picture in the right side. When you want to talk, you're welcome to unmute. You can also use the chat feature, and if your computer decides to act a little crazy today, like mine has, always join us, come back and join us either through the phone or through your Zoom app on your smartphone. So, because we have some good stuff we want to share with you today. So if you're unfamiliar with KCHC or Project ECHO, we're going to share that with you. So I think I'm going to pass the mic to Mona Huff. And Mona's going to tell us a little bit about KCHC.
Well, good afternoon, everyone, and welcome to our meeting. The Kentucky Coalition for Healthy Communities is a group of people, us, that we come together to create community support systems for older adults in partnership with the existing local coalitions and organizations. We help develop the workforce and concerned community members to empower our communities to become healthier. And you're going to hear more toward the end of the meeting, and I certainly invite you to be a part of that so you can help us know how we can get this information that we're learning today out to our communities. Thank you, Pam.
Thanks, Mona. And if you're unfamiliar with a Project ECHO, we've been actually doing Project ECHOs here at the University of Louisville Trager Institute for about 5+ years. It is a platform that was developed by Sanjay Arora, and he's an MD, a hepatitis C expert. It's a telementoring platform that attempts to move knowledge and not patients. He used to have people that were driving 200 or 300 miles to come and see him, and he felt like he wasn't creating local capacity and spreading the knowledge of the hepatitis C that he knew. So he created this platform, and now there's Project ECHOs all around the world and all different topics. They have a certain rhythm to them. There's usually a didactic, there's usually a case of some form, and there's usually this whole focus is to teach all, learn all in the Project ECHO community. So we're going to be talking about best practices and interdisciplinary team-based care in our Project ECHO. So we do ask that you go on and put your name and your organization in the chat. It helps us with attendance and also lets us know who is in our learning community so that we can make connections with one another and find out about all the wonderful things you guys are all doing in your little spaces. So we also ask that you go on and put your name under your Hollywood square. If you haven't done that yet, go on and do that. You just go on and click in the upper right-hand corner, and there's a little box with 3 little dots, and a little dialog box will come down. You can go on and name yourself and type in your pronouns and your organization. So today's presenters have nothing to disclose. And for community health workers that are with us today, this particular session has been approved by the Kentucky Office of Community Health Workers to provide 1.5 CEUs. That's great for certified community health workers. If you're not a community health worker, but you'd like an attendance certificate, we can also provide that to you as well. We'll provide you a certificate for 1.5 hours that you can use. The community health workers have to complete the evaluation at the end to receive the certificate. And everybody else, we do ask that you complete the evaluation as well so we know that you need that certificate. And I now, I believe, am going to pass this over to my colleague, Barbara Gordon.
Yes, good afternoon. Thank you, Pam. Good afternoon, everyone. Welcome to today's panel discussion on the vital role of community health workers in transforming healthcare and public health landscapes, especially within underserved communities. Community health workers are at the forefront of healthcare, serving as bridges between clinical services and the community, often working under challenging conditions to deliver essential health education, support, and services. They play a critical role in improving access to care, enhancing health outcomes, and reducing healthcare disparities. Today, we have gathered an esteemed panel of experts, including seasoned community health workers, healthcare professionals, policymakers, and advocates, to delve into the multifaceted world of community health work. Our discussion will explore the roles, challenges, and successes of community health workers, their training and skills, and the innovative strategies they employ to meet the community's health needs. We will also look into the sustainability of community health work, programs, future directions, and how these pivotal roles can be supported and expanded within the health system. Our goal for this discussion today is not only to highlight the invaluable contributions of community health workers, but also to identify actionable strategies that can support and enhance their work for greater impact. We hope to inspire insightful dialogue, share knowledge and experiences, and foster a deeper understanding of the critical role of community health workers play in our health system. So as I indicated, we have an esteemed panel with us today. First, I'm going to introduce myself. I didn't do that before I started. I'm Barbara Gordon. I'm the Director of Community Engagement at the Trager Institute, University of Louisville Trager Institute. And we have several panelists today: Laura Eirich, Joa McDaniel, Natalie Gober, Pam Yankeelov, Tameka Lester, and Jennifer Montgomery. As they begin their presentations, I do ask them to introduce themselves and let everyone know who you are and what position you're presenting from, whether you're a community health worker, a policymaker, professional working in the field. Just let us know what position you're speaking from. And with that, we're going to hear from our guests, but after they all present, we're hoping to have a really good conversation and dialogue about what we've learned today, but also, just to talk about community health work in Kentucky and what its future look like. So don't hesitate to write your questions down so that you can ask those questions at the end. I'll repeat this when we're finished, but we'll ask that you put your questions in the chat. As they come to your mind, you can write them down and put them in the chat after the presentations are completed. You can also, at the end of the presentations, unmute and ask your question verbally. And again, I'll repeat that after we're done with our panelist presentation. So first on our list of panelists is Laura.
All right, thank you so much, Barbara, and thank you to everyone for having me today. My name is Laura Eirich, and I'm the administrator at the Kentucky Office of Community Health Workers that sits within the Department for Public Health. I also have experience as a community health worker, so I'm coming from that background as well. And Joa will introduce herself later. She's speaking after me, but she is our training coordinator here at the Department for Public Health Office of Community Health Workers. Some of you, I saw some familiar names in attendance today, so some of you may have seen this slide 1 or 2 times before, but I always like to give it as kind of like a level setting. And I always refer to this as like the extremely abbreviated Cliff Notes version of our history of CHW work in Kentucky. This is not all inclusive by any means, but simply used as kind of a visual aid to show you where we've started, some of the big highlights and where we're going, right? When it refers to CHWs. For some of you on here, you might not know, we have a pretty long history with CHW work here in Kentucky. We began most formally in the early 90s with the foundation of Kentucky Home Place out in Eastern Kentucky. That was created through state funds and still managed here through the Department for Public Health. Between 1994 and 2014, we started to see real growth in the CHW world with different CHW programs starting all across the state. Namely, we always talk about Montgomery County starting the first Promotora program. There were several other Promotora programs starting in the Lexington area at that time as well. We really started to see growth in the Louisville and other urban areas around 2010 with different CHW programs starting there. And in 2014, the department does what they do best is we bring people together, right? So we saw the need to bring CHW supervisors, allies, stakeholders together to have conversations about how we can support and strengthen and promote this really vital profession. And so that's where the advisory work group was started. And that group still meets today. And if you're not a part of that listserv, I invite anybody, you are welcome. It is for all CHWs, allies, and anyone who is interested in that space. We provide updates from the Office of Community Health Workers. We have guest speakers. It's a space for sharing. And that group meets quarterly now. But back then, they met monthly or even more than that to really lay the groundwork of certification, the code of ethics, the core competencies, all of that we have today. It started back then with this group, which is really cool. On the second line, I'll point out just a few things. In the green line, the second box from the left, you'll see in 2016, the Kentucky Association of Community Health Workers was launched. We call that the kayak. It doesn't spell kayak, y'all, but that's the closest word we could associate, okay? So that's the Association for CHWs. That's the grassroots group that is led for and by community health workers. So all of you who are CHWs or work within that space, we absolutely encourage you to join the association and become a part of that. In 2019, we launched certification in Kentucky, which was a really momentous thing because we started working on it formally back in 2014. So, it takes a long time to get it right and to come to a place where we felt comfortable, but more importantly, the association and their members and CHWs felt comfortable and felt that we were at a place to start this. In 2020, we had our first Stories of Success report. 2021, we received the first CDC CHW grant. There were several other grants, large CDC and HRSA, and several other large grants that kind of were around that time, all in relation to CHWs. And then in 2022, Kentucky passed House Bill 525, which I'll talk about a little later. And in 2023, we started Medicaid reimbursement, which I'll also start later. So you can see just how far we've come from the early 1990s to now. And you're going to hear from myself and the other panelists about all of the exciting work that's to come in relation to community health workers. I love to show this slide to help show the diversity of where CHWs can work. I always say that there's no wrong place for a community health worker as long as they're serving the needs and meeting the needs of their community, right? And that's going to look different for every single community or group, right? So in Kentucky, we've got CHWs in schools, homeless shelters, senior centers, jails, federally qualified health centers, rural health centers, pharmacies, hospitals, faith-based organizations, dentists, community centers. I know I'm leaving some out, local health departments. The list goes on and on. So it's just really amazing, especially if we're comparing, what it looked like 6-7 years ago to what it is now. The type of organizations where CHWs are making an impact is so different, and it's just so amazing. And we can go to the next slide because I'll show another way to look at it. This is a static image of a map that we have been working on in the Office of Community Health Workers, which we hope will be on our webpage soon. And it will show you all of the known active community health worker programs in the state of Kentucky. So you'll see the little golden colored icons represent an individual organization and individual address where a CHW is employed. And you can see the broad categories, which we're also working on refining this year. But you can see some of the broad types of categories. The counties that are colored in blue are counties that we know are served by a community health worker or community health worker program. So you might notice that there are some counties that are colored in blue, but there might not be, a little golden icon. That means we know that they're served by a CHW in a neighboring county, but we don't necessarily have data on an active organization that employs a CHW in that county. And now this is based on a variety of data sets and self-report. So if we're missing something, we always encourage people to let us know, to share. If you live in Breckinridge County and you know that there's a CHW program there, please let us know, because we want our data to be as up to date and accurate as possible. There are a few counties on here that are not colored in at all. They're grayed out. That reflects the few counties that we have no data on whatsoever, but we are working to get some data on that. And so this, like I said, will be up on our webpage hopefully within the next few months, and we can continue to make updates and people can access this data whenever they want. This is a very brief snapshot of CHWs in Kentucky. So the last two images kind of showed the type of organizations, but if you added them all up, there's over 60 organizations that have integrated and are employing community health workers across the state, which is amazing because I think when I started in my role about 5.5-ish years ago, there was about 12. So just in a very short amount of time, this has grown so much. The number in the middle is actually wrong and we got updated already. So there's actually 240 CHWs, certified CHWs in the state as of today. So that is really exciting. And you kind of saw this on the last map. There's about 110 counties that are served by a CHW or a CHW program. I'm going to briefly touch on CHW certification, which is currently optional in the state of Kentucky, but encouraged as it really helps demonstrate that individual's achievement of the 8 CHW core competencies, which Joe is going to touch on. Some benefits that CHWs have noted for obtaining certification is, acknowledgement of their unique training experience and diverse skill sets and lived experience. It helps further career goals and increase employment opportunities. It helps build individual confidence. It helps CHWs stay abreast of current research through opportunities through continuing education. And it also helps increase respect and recognition for CHWs and the important work they do within communities and healthcare and community settings. In order to get certified, all CHWs have to have their training record or position description, mental health first aid certificate, a reference, a mentorship or related work experience letter, a photo, and payment of the fee. And we have an entire webinar dedicated to this. So if you want to get into the nitty-gritty and listen to me talk for like an hour about it, we can put that in the chat for you or share it. And once someone's certified, they are able to use that CCHW designation on their business cards, their resume, their email signature, all that. And certified CHWs are required to earn 10 continuing education units and renew their certification annually. These are the two pathways that somebody can to get certified in Kentucky. So we have certification based on training and mentorship and certification based on work experience. So training and mentorship is typically geared towards those new CHWs, and it's 40 hours of foundational training, 8 hours of mental health first aid, and then a 40-hour verifiable mentorship or field experience. And then work experience is for those who have been in the field and have at least 2,500 hours of verifiable work as a CHW, plus those 8 hours of mental health first aid. I won't go into this slide in that much detail, but I do want to briefly mention just our role as the state. We're obviously the credentialing body for CHWs, but we exist to support, strengthen, and sustain the CHW profession. And that we kind of joke and say that we're kind of the wheel where CHW activity flows through. So we're here to support in a myriad of ways across the state for individual CHWs, organizations, supervisors, what have you. I did mention House Bill 525 at the beginning, which led to the KRS, which is Kentucky Revised Statute, which is the law, and KAR, the administrative regulation, which details how we plan to carry out said law. It basically talks about CHW certification and what we do as the Office of Community Health Workers. They're hyperlinked here, and they're also hyperlinked on our webpage if you're interested in reading those. But I will let you know that this is the best case scenario. What is put in the law was almost directly taken from our CHW certification manual. So if you're familiar with the manual, you're pretty much familiar with the law, which is a good thing. And then last, I know we're going to talk about this probably in the questions, but sustainability is one of our major focuses. We are very excited that Medicaid CHWs can reimburse through Medicaid starting July of last year. And I've hyperlinked some important resources. I do want to specifically point to the frequently asked questions and then the presentation slides, because I do think that those do a good job of explaining what is covered, you know, the codes, the type of providers that can supervise CHWs, you know, all of those very detailed questions, and those will be hyperlinked, and they're also on our webpage. And I don't think we're getting into it today, but you might have heard about the changes to the Medicare physician fee schedule, which now includes services addressing health-related social needs, and CHWs are included in that, which is very exciting. I've included a link to a recent webinar that we participated in that I think will be really a great resource for you all as well. And I want to transition, I think, to Joa so she can talk about CEUs and training.
Good morning. Hi, I'm Joa McDaniel, and I am the Office of Community Health Workers Training Coordinator. So I'm just going to talk to you a little bit about how places can get continuing education units for their trainings. At the end of my presentation, I will show you a nice one-pager of all the things that you need to have continuing education units, but I've broke it down here on these slides. So the first thing is you have to have a SMARTY learning objectives. And if you would like to learn more about the SMARTY learning objectives, there is a section in my one-pager that explains all that. The content needs to meet at least one of the CHW core competencies, and I will go over those in just a minute. Attach the training flyer or agenda to your application with the start and end time. The flyer is good for us if you like to promote your CEU offerings. So we will put that in the Coach Connection, which is our newsletter that we send out every other week. And you can go to this slide. Okay, so here is the core competencies. Each of these competencies have subcomponents to them. They are all in the our manual. It's in Appendix A. So if you guys want to learn any more about this, you can always go to our manual, and we have it linked in this presentation. So the first one is communication. The second one is use of public health concepts and approaches. And the third one is organizational and community outreach. The fourth one is advocacy and community capacity building. And the fifth one is care coordination and system navigation. And then the next one is health coaching, and then documentation, reporting, and outcome management. And then the last one is legal and ethical and professional conduct. And like I said, each one of these has sub competencies underneath to explain it a little bit more. And all of our trainings have to fall under at least one of these competencies. So then you also need to attach a CV or a resume for each presenter. We also added a new addition to our application. We would like to know how a CHW was involved in the planning, development, and reviewing or the delivering of this training. This is strongly encouraged, but we know that that can't happen every time. But we would really want CHWs to be a part of the trainings. And then we do the coach standard evaluation questions, and I have that attached to our one pager as well. And then a certificate for the CHW at the end of it. And I have a picture of what needs to be on the certificate on the next slide. So it doesn't have to look exactly like this, but we ask for it to have a learner's name, the title of the training, the date, and then our training blurb that tells you how many CEUs you are providing for the training that you are offering. And so this little tiny picture on the corner is the one pager. It is linked into this presentation. It's really nice. It's a step-by-step. It tells you exactly everything that you need. And then the link at the bottom is to the actual application. So you can go through this, gather all your stuff. And then once you go to our RedCap link, you have all of your materials in one set, and you can start uploading and everything, all the information. So some of the CEU topics, this is how we know what the CHWs want. We don't just randomly put trainings out there. We do core competency assessment. And then the 2109 grant participants have participated in this assessment, and they will do it the beginning and at the end. And then so the CHW CEU course evaluations, we always have a box in there asking what topics they would like to learn more about. And also we do a lot of data collection. We have a wonderful data coordinator, Casey Rhodes, who she scours our data and tells us what the CHWs are wanting in their training. There's a monthly data collection, focus groups that we have that are in person and virtual. And then we have grant feedback surveys as well. And here are just a couple of, or a few topics that CHWs ask for. Diabetes is a very popular topic, maternal health, older adult care, of course, harm reduction, mental health, heart disease and stroke, and Medicaid and Medicare are like at the top of our lists. And then I just would like to put in a plug for our Coach Connection. If you don't get the Coach Connection, like I said, it's our newsletter that goes out every other week. It has all of our trainings that we have approved for CEUs if they choose for us to promote them. And it has other information that we need to get out to CHWs and CHW allies. So this is a great way to stay connected with our office. And like Laura and I said, these are all the resources. There's the manual, the certification one-pagers. We have a lot of one-pagers that explain a lot of the things that we do in our office. So if you want to learn more, this is a great resource. This page is a great resource. And I think me and Laura are finished. So thank you for having us.
Hi, everyone. My name is Natalie Gober. I am a program manager at the Trager Institute. I oversee our paraprofessional program through our Behavioral Health Workforce Education and Training Program grants, which we call BWET. So I'm going to tell you a little bit about our training program format today. We actually have 2 BWET grants at the Trager Institute, and the first is for professional students. I believe we're in our 2nd cycle of that grant and looking forward to our 3rd. And that one funds behavioral health professional students to improve that distribution of quality behavioral health workforce. So students who are doing their practicum in behavioral health related fields often do that through the Trager Institute. I know many of you are with us here today, so we're excited to have you here. But the paraprofessional grant really started thinking about what it would look like to meet people much earlier in their learning journey, right? So if the professional grant funds people and supports them when they are at the end of their education, and you're never done learning, but you're finishing up your master's degree, you're about to be certified and able to work in the behavioral health fields, then what would it look like to certify and train people much, much sooner and start that pathway for them? And so really the paraprofessional grant looks at expanding community-based experiential training to increase the number of people who are able to work in behavioral health by offering certifications such as peer support specialist, community health worker, and other behavioral health related paraprofessionals. So thinking about how we can provide a non-traditional access point into behavioral health work while valuing the lived expertise of people who may not have kind of seen college as that traditional starting point for them. So really the overall purpose of both grants is to integrate behavioral health into primary care. And this is our favorite slide. If you all have ever spoken to me, you've seen this slide. So it really lays out all of our programming and our pathway within the paraprofessional program to show you what's possible, right? So I want to say that it's not prescriptive. It's not something that you have to go A, B, C, D if you're in that paraprofessional pathway, but it's what's available to you. It's what is possible for you. So you can see in that bachelor's and master's degree up to the right, that's really where our professional grant has lived for a long time. And so with the paraprofessional grant, we moved all the way over to the left to start at that pre-apprenticeship and think about how we can support learners in different ways. So I'll try to be pretty brief because I could talk about this for a really long time. And there's a lot of detail and nitty gritty in it. So I'll try to keep myself at surface level if I can. But within our pre-apprenticeship, we have learners who join us for 6 months. We take a cohort of about 21 each year, starting in October and staying with us through the end of April. And the only requirement there in terms of education is that they have to have a high school diploma or GED, right? So really emphasizing that this is kind of that non-traditional access point into working in behavioral health. You do not have to have a bachelor's degree. In fact, we prefer it if you don't. So really meeting people where they are in terms of education. They stay with us for those 6 months, and during that time, they're meeting with us every Wednesday on Zoom for 4 hours, which is a long time to be on Zoom from 9 a.m. to 1 p.m. every Wednesday. And they're getting that classroom training for the certifications offered by the state. So during that time, they're earning their Kentucky Family Leadership Academy certification and their Adult Peer Support Specialist certification. And those are 2 certifications, especially adult peer support, that allow you to work in behavioral health and be billable. Okay, so that's a really great starting point in terms of a career in behavioral health. We also frame that education with some experiential learning. So there are other state approved providers for adult peer support. We are not the only ones. It's very important work, but our program is structured differently in that we frame it with additional trainings that we think are beneficial to our learners. So looking at motivational interviewing, the neuroscience of addiction, adverse childhood experiences, things that may not be necessarily required to be in depth in that curriculum, we kind of tack on as extra learning that our learners can participate in. And then we also integrate experiential learning. So our learners participate in case conceptualizations where they see our professional students present complex client cases and they can offer their feedback about things that they've seen, right? So really digging into the value of that lived expertise. So they're not presenting clients, but they're able to say, you know, when I was a caregiver for my grandmother, here were some resources that were really helpful for us. Or when I was going through active addiction, here's something that really helped me, right? So really showcasing the value of that lived expertise. They also participate in simulations where they get to do basically video games of behavioral health. So they do online simulations where they get to practice talking to a client and seeing how that client might respond in different ways. So really the gist of the pre-apprenticeship is that they're getting a chance to try on behavioral health in terms of training and opportunities, but there's no risk, right? They're not seeing clients. They're not at risk of harming someone accidentally through their approach. It's really just a chance to practice it and try it out and see if it's a good fit for them. We also provide a stipend to support them and a laptop. And what we've learned after providing a laptop is that we also have to provide technology training. So we provide technology training twice a month for our learners, as well as career readiness training, looking at resumes and interview skills and things like that. So really a full, well-rounded workforce development program in 6 months. You can see in that last bullet that it does say that if they have lived experience, they earn that training towards the peer support specialist certification. And we've actually updated our requirements since creating this slide. So everyone who comes to us has that lived experience, they self-identify, and that is the state requirement for adult peer support. So after that first 6 months, then there are a couple of different options that we've really seen people engage with. The first is that they move on to the apprenticeship with us, and I'll tell you a little bit more about that in a second. The second thing that we've seen is that they use their adult peer support specialist certification to leverage for promotion at their current workplace. And they say, I'm happy doing this, and I get to continue to work and do more with this certification. Or they may seek out employment as adult peer support at that time. The third option is we've seen people jump straight into a bachelor's degree, right? They said, this didn't feel like an option for me before, but now I know I want to be a social worker. I'm ready to start my bachelor's degree, which is great and exciting. And then sometimes people say, this has taught me that this is not the field for me. And that's hard to hear, but there's value in it. And so getting the chance to try something on, again, without risk, and have that support, and be able to see if it's a good fit for you or not before you spend a lot of time and money on education in it. So if they do move with us into the apprenticeship, then they're with us for another year, so another 12 months, which makes it 18 months total in the program. We like to joke that the pre-apprenticeship is like a 6-month interview. So they're with us for 6 months. We're seeing how they engage. We're seeing how they ask questions and connect with material. And then they move into that apprenticeship. And through the apprenticeship, we have employer partners across the state of Kentucky who agree to hire a certain number of our apprentices as community health worker apprentices. During that time, they're working full-time with benefits, and they're still engaging in training with us on Wednesdays. So our employer partners agree to allow our learners to continue their training with us during that time. Most of our employers consider it on-the-job learning, so they're able to count that as part of their 40-hour work week. So they're with us, they actually get an extra hour. So if you thought 4 hours on Zoom was bad, they get 5. So they're with us for a good amount of time on Zoom on Wednesday mornings, but we tack on an extra hour in the morning so they get that supervision and support for the work that they're doing and the certifications that they're pursuing. And during that year, they get to earn their Community Support Associate certification and their Trauma-Informed Flourish Care Community Health Worker certification. If you're wondering why that's different from a certified community health worker, it's just because we had to be fancy. So we had to add our lens of trauma-informed care and interprofessional teams of care. And what's been really fun is to see the way the state has also started to filter in that trauma-informed care. So we love that collaboration. They do receive a stipend during that time, again, to support them in that training time, in addition to their benefits from their employer. And ideally, at the end of the year, they stay in their employment, right? That's the purpose of apprenticeship, is that they get that starting point and then they get to move forward in the career. So ideally they stay, but if they don't want to stay, or if their employer doesn't want to keep them or can't keep them for any reason, then that apprentice is eligible and ready for employment in the healthcare field, right? They have those certifications that are so valuable. They have that year of experience, which is often the biggest barrier to starting out in a new field of work. And then if they want to move forward into education, they definitely have that capability. We've built pathways with the University of Louisville with 2 different programs, the BS in Organizational Leadership and Learning, and then the Bachelor's in Social Work as well, to really try to value that lived expertise again, but also the time that they spent in the certification and training program with us to transfer in some credits for that time. And then maybe they decide to do their practicum with Trager and it's full circle, right? So there are a ton of options. So that's my nutshell of this. There's a lot more to it. And I'm happy to answer any questions. I know Chelsea, I think, has been answering questions in the chat. So thank you, Chelsea. But we will move forward from that, just for the sake of time. And I do want to look at our reach across the state. So this also probably needs to be updated, if I'm being completely transparent. But really, I put this here because I want to highlight that Trager follows the hub and spoke model. And what that means is that our clinic is located in Jefferson County in Louisville. But we have students and learners across Kentucky. So because we offer that training virtually, we're able to engage with pre-apprentices, apprentices, and also professional students across the state. And the value of that is that when we think about behavioral health careers, especially in underserved communities across Kentucky, maybe rural areas like Eastern Kentucky, the problem traditionally has been that to get the education and training that you needed to serve your community, you had to leave your community. And that's not what a community health worker does, right? They stay in their community that they're already part of. And so if we follow this train and retain model, we're able to train people where they are by offering virtual opportunities, virtual education, and then they can stay and serve their community. And there's so much value in that for many, many reasons, but especially because they're already part of that community, they're already trusted there. They already have the connections, right? So community health workers are so valuable for so many reasons, but especially because they're already connected into the community and the resources that are there. And so because they see the strength of that community and they're part of it, they're able to better serve it. And so we really want to reinforce that and support that by offering that training across the state. And the last thing I'll share with you is just a list of some of our current and previous employer sites for the apprenticeship. So Laura shared that beautiful slide of where community health workers can work, and it really is anywhere. They're definitely needed anywhere. And we started with a goal of really employing them in primary care. And we have expanded that a little bit to look at other healthcare providers, social service providers, rehabilitation homes. So thinking about the plethora of places that community health workers can be valuable and can support the communities that are most in need of their services. So we do have quite a few established apprenticeship agreements. I'm not going to read them to you, but we're very thankful for all of our employer partners. And I think that's it for me. So I'll pass it off to Dr. Pam.
Hey, thanks, Natalie. All right, everybody. So my goal is to make sure that everybody wants to become an employer site for this particular apprenticeship. And if you're outside the state of Kentucky, you want to start an apprenticeship program because we want more community health workers, right, in our state and across the United States. So that's my goal. Let's see if I can do it. So if you're interested in becoming a trauma-informed Flourish Care community health worker apprenticeship site, there's 3 things that you need to do. Okay. One, you're going to explore with the Trager Institute, become an approved apprenticeship site, and hire. And the reason why I'm talking about this is I'm the director of research and evaluation. You guys know that, but I'm also the director of evaluation on this particular grant that Natalie spent some time talking about. And so as you know, Natalie was telling you, we have to have employer sites for our apprenticeship. And there are so many different employer sites that you can do. Our goal of ours is to really try to get behavioral health into primary care. But as Natalie said, primary care, think of it in quotation marks. It can be broadly defined. Okay. And she gave you all the apprenticeship sites that we have placed apprenticeships or have hired apprenticeships. All right. How about the next slide? All right, so first, meet. So if you have any interest in hearing more about this, you can informally talk to anybody on our team. In one form or fashion, all of us have worked on our behavioral health workforce enhancement training program, apprenticeship program. So you can reach out to Chelsea. Chelsea has been answering some texts or some chats, and she's very involved in the apprenticeship program, teaching our community health workers. And you've already spoken to Natalie, but you can also reach out to Barbara and myself. Why would you be interested in having an apprenticeship at your employer site? Well, there are many benefits. One is that you are able to recruit a diverse workforce through an apprenticeship program. It also reduces turnover because you have this apprentice for an entire year, working those 2,000 hours, getting to know you, you getting to know them, they get to know your culture, you get to retain that top talent, and they just become a part of you, but it's through kind of this apprenticeship year. There's also the benefits of having billing opportunities. We'll talk about that in the next slide. You also have this opportunity because we bring all of those apprenticeship employer sites together about once a month to talk about the successes that you're having, the things that you're learning, and how to make sure that your experience for your apprentice is positive. Plus, we also listen to all the things that maybe we should incorporate in our training. And we've learned a lot about the things that we might want to incorporate in our training to make sure that our apprentice can really, do the best that they can in their particular employer site. So just to kind of quickly go over those expectations that Natalie's already said, when you take an apprentice on, that you are agreeing to certain things. You're agreeing to hire them as an employee. You're giving them a livable wage, a minimum hourly rate that's market value. You agree that, 6 months in, you're going to do an increase at 10%. They do work the 2,000 hours, which is full-time work. As part of an apprenticeship, as Natalie was saying, there's 144 related hours of instruction. Every apprentice has to have a credential associated with it. As you know, ours is the community health worker credential, and it also has the community support associate. There's a work process schedule. And what that is that there's an agreement about how it is that you're looking at all those job functions and those tasks of a community health worker, and you're making sure that the individual is meeting those particular job functions and tasks. And of course, just like any other employee, there is supervision of that individual. So here are some things related to billing. I know that, Laura, you can definitely add some detail here, and maybe during the question and answer, you can also do that. Maybe there's actually a website we could also give them. But I am very excited about these billing opportunities, as Laura was talking about too, that in July of 2023, Kentucky now has allowed Medicaid billing. And those are some CPT codes, 98960, 98961, and 98962. And it's related to, what do you get paid for one patient or a group of 2 to 4 patients for 30 minutes or 5 to 8 patients for 30 minutes. And there's a different rate per patient. And of course, it goes down as you have more patients. But there's also this new community, it's CHI, it's Community Health Integration Codes in Medicare that just started in January 1 of 2024. So what it is it's a Part B benefit. Okay, so this is for Medicare, and what it is that you a community health worker can under Institute 2 billing can bill for things that are related to the work that they do, whether it's like transitions of care or care coordination or working with someone on their health literacy or providing emotional support, some support. So those particular billing code is there. It's G0019. You can bill for 60 minutes per month, per calendar month, for $79.24 as instant billing. So it's supervised by a provider. And then you can do an additional 30 minutes for $49.44. That there is no cap as to the number of additional 30 minutes that you can do per month, which is great. If that person has need and it is documented, then that can be billed. There's also a social determinants of health assessment that if you use some of the approved assessments like PREPARE or the accountable care assessment that's for health-related social needs, I'm sure I'm missing a word there, it's another $18. So this is very much exciting that Medicare is now seeing the value of these community health integration codes and including community health workers as an auxiliary kind of person that under the supervision of a provider can bill. So there's one other thing I wanted to share about this, and I can't think of it at the moment, so we're just going to go on, and I'm sure it'll come back to me. So how do you become a trauma-informed Flourish Care apprenticeship employer site? Okay, how can you become one of those? So there's basically 3 little things. You have to review the standards of the trauma-informed Flourish Care community health worker apprenticeship employer site. What it is that you have to be able to agree that you're going to look at this work process schedule that I'll show you, and I have a picture in the next slide about the job tasks and the functions. You have to agree to allowing your apprentice to participate in the 144 hours of related instruction that's required for the apprenticeship that's provided by the Trager Institute, and you have to have, of course, agree to a wage schedule for the individual. There's an acceptance agreement that allows the actual employer to be registered as an organization in the apprenticeship. And then there's also a 1-page occupational agreement where you establish the specific apprenticeship occupation. Here is community health worker at your organization with that wage rate. Next slide. So here's just an example of the actual community health worker work process schedule. It basically just lists some of the things out that you definitely would align with the competencies of a community health worker. We changed it slightly. We were only allowed to change it about 20%. And the reason why we were able to change it slightly, 20%, was to add that behavioral health focus so that we could incorporate that particular focus into our community health worker apprenticeship program. Here is the actual employer acceptance agreement. Literally, it's a page and a half, and you fill in some fillable fields about, and you get it signed. But you're agreeing to the standards of the actual apprenticeship. And here, then what happens is that once you have been approved by our state approving agency, which is the Kentucky Office of Employment and Apprenticeship and the Department of Labor, you are then a registered apprenticeship site, a registered employee or apprenticeship site. And you get this great certificate that you can put on your wall. And then what happens is that you can actually hire an apprentice. And I believe we have several individuals that went through our apprenticeship program with different employer sites with us today. And you're going to hear one after I close it down in just a second. And so what happens is that you then put a job out there, you interview, you hire your individual. As Natalie said, we'll have individuals that come out of our 6 month class that would be interested in becoming an apprentice, and you can hire from then. And then you have to train. You have to do the 2,000 hours, agree to the 144 hours from the Trager Institute, in which they will be getting their community health worker certificate through the Kentucky Office of Community Health Worker, and get that the Community Support Associate credentials. And then you meet with your fellow colleagues to share those challenges and those triumphs in that monthly roundtable conversation that you have that in order for us to be able to assist you in making sure that your apprentice has a very successful experience in your approved apprenticeship site. And I think that might be it. So yeah, so reach out if you have any additional questions. I know how to go through that fast. And that's it. I think now what we're going to do is we're going to turn over to, this is kind of our case example where we're going to have Jennifer Montgomery as a supervisor for a certified community health worker who is an apprentice in our program, and Tameka Lester, who's going to talk about her experience in primary care as a certified community health worker. So I'm going to pass the virtual mic to you guys.
Thank you, Dr. Pam. Good afternoon. My name is Jennifer Montgomery. I am a program coordinator here at the Trager Institute. And I just wanted to talk about the need for our CHWs in our clinical setting at our primary care site. So back a slide, please. Thank you. We offer CHW, our CHW that's in our clinic offers support Monday through Friday for our patients being seen in the clinic by the providers. She brings lived experience and resource knowledge. She gives knowledge. We have student learners as well, so she is very knowledgeable in community resources, and they often go to her as well for support. She's also that bridge between the patient and the nursing team, along with the providers. And she is an advocate for patients' healthcare related goals.
I'm sorry. Oh, I'm sorry.
Okay. So the workflow that she kind of goes through in the clinical setting is she's integrated into our annual wellness visits. She holds caseloads of patients. She's available to address the needs of patients being seen in the clinic in real time. So that's if a provider has a need for a patient for food insecurity or anything, they can get Tameka, and Tameka will talk with that client and get them established with some resources. We have a Pantry RX located at the Trager Institute, which she is very involved in as well. And she helps with community engagement activities such as the Flourishing Together classes to build that health equity. And she makes sure that she documents all encounters that she does in the clinic. So Tameka has many roles and responsibilities in the clinic. I've just highlighted a few here. She assists with annual wellness visits where she completes the following assessments, such as the MOCA screening for cognition, the hearing screening, and the get up and go for balance. She completes Flourish Care assessments with each of the clients that she's working with during the intake process, and then every 6 months thereafter to assess for progress towards her goals. She creates care plans that align with the patient and what matters most to them. And then I'm going to pass it over to Tameka, where she's going to talk about some of the amazing work that she's doing with her clients in the clinic.
Sorry, having small technical difficulties. Good afternoon. My name is Tameka Lester. I am a community healthcare worker here at Trager Institute. As Jennifer said before, I basically serve as a liaison between the medical team and social service team here at Trager, and I also advocate again for the community. I have a couple of case studies. There was a patient that came into the clinic that was in crisis, looking to get established with a PCP. Patient was introduced to me. At the time, the patient was experiencing unhoused homelessness, did not have access to medications, and did not have any income. So therefore, I began working with the client on housing, getting their medications, and helping them to navigate for disability and or SSI. The patient now has housing, although it's not the best, but we did establish care for that. The medications had came to the clinic where I resigned due to his housing situations to make it confidential for him. I also took the patient their medications a few times. Right now, the patient is now in a stable housing. Medications are being delivered to the patient's home, and the patient is now receiving SSI benefits. Next slide, please. My second case study, there was a patient was referred to me as an immigrant needing housing, social security cards, identifications, insurance, and also food benefits. I helped them connect to various resources of housing in the NIA Center for their identification and DCBS for insurance and food benefits. The patient is now has housing. They have flourished really, really well. Both of my case studies, they're receiving food benefits and of the resources that I connected to. This is my email, myself and my supervisor, Jennifer Montgomery. If you guys need any information, any resources, please feel free to reach out. And I really thank you for listening.
So, thank you very much. That concludes our panel presentations. And we do want to thank Laura, Joa, Natalie, Tameka, and Jennifer, and Pam for all of this wonderful, valuable information. I noticed that there were a lot of questions in the chat, and thank you, Chelsea, for responding to some of them, as well as Natalie and Pam. I'm going to try to make sure that I don't miss any questions in the chat, but if you want to put your questions in the chat, make sure you do. I have colleagues here who will help keep me on track with those. If you don't, if you don't want to put them in the chat, you can unmute and share those with us openly. So this is the opportunity for Q&A. A lot of information was thrown at you. I'm sure you have some questions. Please share them with us now.
Hi, everyone.
Hi.
That was a great presentation. Hi, Miss Barbara. How are you?
I'm good. How are
Oh,
you?
I'm so but one of my questions, I keep asking this, so I don't know if there is a new response yet, but is there a cap or a number of that's a limit to the number of cases that you can carry, or the number of clients that you can carry on a caseload? And is there a number or a cap to the number of clients you can bill to Medicaid, Medicare per month per client?
I'll let Laura, you may have to help me with this, but no, there's not a number on caseload per se, but there is a limit, and I'm pretty for sure it's annually, right, Laura? As many units, is it 130 or
104.
104? Okay, so you can only bill 104 units annually for a
100.
client.
Okay.
I didn't know. I was going to respond in the chat, Miss Angela, but I didn't know. Listen, I was trying to give more than the state will give. I tried to give 140, or 130, but yeah, 104, and that's annually. But no, as far as like the number on caseload,
Mhm.
absolutely not. And we've seen kind of in it, the way it's set up, it's really nice. It can kind of, you carry someone on caseload, you're billing for that. They don't need services anymore. You can, in services, discharge, and then say in 2 months they needed additional support. You're able to pick them right back up as long as you're under that 104.
Okay, I love that.
So
you.
the cap is on the number of units that each patient can receive, and not necessarily on the number of units that the CHW can bill. Is that correct?
Mm-hmm.
I can put the link to the FAQ from Medicaid in the chat if you would like me to, and it has it broken down. I saw that Chelsea was answering a lot of them, so I was like, oh, I'll let Chelsea. I didn't want to like step in. I can put that link in the chat.
That'll be great. Thank you. Right. Are there any other questions? I know I have a few, but I'm not going to ask mine until I make sure all of you have the opportunity. All right. So I'm going to ask a few questions here. So, and this might be to Jennifer and Tameka, or any other community health worker who's on the call. What are the most significant challenges faced by community health workers today? What are some of the most significant challenges?
Some of the most significant challenges is on housing and food benefits.
Housing and food benefits. Anybody else?
I would like to also add, I think somebody just put it in the chat, but transportation as well, especially in rural areas.
Yeah, Anita, I'm glad you said that. And just the resources, when working with the community health workers, especially in Eastern Kentucky, the limited number of resources, but how they're able to plug in and being a community health worker, they're able to, it's more accessible in a sense. They can connect with the right people, have those conversations. So yeah, absolutely. I think just your resource rich areas, but also there's just a limited number of resources statewide that everyone's trying to tap into. And so I think that's a huge burden no matter where you are in the state.
Mm-hmm. And Laura, this one's to you just from a more broader perspective. And again, there are others who might have other questions, who may be able to respond to this particular question. But how are you seeing healthcare professionals, institutions, healthcare systems? How are you seeing them supporting the work of community health workers? We have a lot more community health workers in the state certified now than ever before. Of course, that certification process is it's like a baby, it's an infant, right? But we're growing pretty exponentially, which is wonderful. So obviously the network is embracing this concept, but can you talk a little bit more about it and help us to understand a little bit about how that's happening and why you think it might be happening?
Can you rephrase that? Because I feel like I got a couple questions in there and I want to make sure I'm answering you correctly.
Just mainly, how is the healthcare system, professionals, institutions, the whole collective healthcare industry, how are they embracing the work of community health workers, respecting it even?
Oh, and yeah, that might be two different things. We might be seeing embracing, but not. It depends. I would say it varies a great bit, and I don't even know if I can properly make generalizations across different industries, like FQHCs versus hospitals versus whatever. I think it really comes down to having leadership and supervisors who truly understand what a CHW is, what they're not, the scope of work. And if they don't understand, being willing to learn and try things out. We have been doing a lot of work. I say Malia, who's our engagement coordinator, to do supervisor roundtables and supervisor sessions, because data shows, and more importantly, CHWs tell us that they're more likely to stay in their role if they have supervisors who truly understand them and support what it means to be a community health worker. And so I think we see better success in organizations who have supervisors who let their CHWs go outside of the office,
Yes.
be in the community, be out there meeting patients where they are, understanding that being a CHW is a unique role and it's its own profession. Your CHW is not also your front desk worker. They're not also your translator. They're not also your, janitorial staff. Those are all equally important and valued roles within your organization, but they are separate. And so having people who understand that, I also think providing that professional development opportunities for CHWs to take trainings during their work hours, to pay for those trainings, to pay for their certification and their association memberships. And so we try to take it, one organization at a time to provide that. We promote the best practices and that integration, but it really depends on the organization. And I don't know if I can make any sort of generalization, but I would also say we also like to connect some of those newer organizations or organizations that haven't fully embraced the beauty of CHWs yet to our experienced organizations, so that they can learn from one another.
Yeah, great. Your response also had a lot packed into it. And one of the things that really, I think, is really important for us to remember and to know, what you stated, is that many entities within the healthcare system really don't understand what a CHW, what a community health worker does, what their role is, et cetera. So being able to educate and inform is a really important thing. There's a question in the chat, and this is for the CHWs in our audience, and particularly our panel member. Who is the ideal supervisor for you to do your best CHW work in the hospital setting? So this is specific to hospital setting. Don't know if we have any CHWs on our call today who work in the hospital setting. And then the second part of that question is, do hospital social workers always embrace your skill set? Do we have any CHWs who actually work in the hospital in our audience today? Maybe not.
Can I take a
And
shot at it?
I will share that we at Trager Institute are looking at that particular model, but for the person who asked the question, we're looking at it from the perspective of pairing them with a social worker. That interprofessional and interdisciplinary team concept is really important. So that's a good question. And I think it also aligns with what Laura was sharing earlier, that not all environments yet know what to do with or how to engage a community health worker. And we have this question. Would you agree that in Eastern Kentucky, a community health worker may be able to find informal supports when there are no formal supports available? Any of our panel members, particularly Tameka, I know you don't work in Eastern Kentucky, but I think this is a reality anywhere.
As I am a CHW here in Louisville, Kentucky, we can always collab and we can always share resources with one another. And I will definitely put my email in the chat.
Right. So let's see. One to CHW, can this work be considered practicum hours, or do we have to complete all practicum hours or a degree prior to becoming a CHW? Who would like, that's either Natalie or Pam, I think, maybe.
You can go with that one, Natalie. You want to?
Yeah, I mean, is it a question about the practicum hours if they were to do practicum with the Trager Institute? I think I need some clarification.
Yes,
Yeah.
I thought
Okay.
the same thing. Let's clarify that. Princess, would you like to clarify a little bit more? You can unmute and ask.
What I'll just say while we're waiting, and hopefully Princess, you can give us some clarification, is that really it's two separate processes. So when you look at that stair step, the CHW certification offered through the Trager Institute through our paraprofessional program is separate from the practicum placement. So we don't actually recruit apprentices. We recruit pre-apprentices, and then they stay with us for 6 months, and then they move into apprenticeship placements. And then later on, if they want to pursue a bachelor's degree and complete their practicum with us, we love to have them back. It's always a beautiful reunion, but they are two separate things. So hopefully that answers your question, but if not, I'm happy to follow up on that a little bit.
Okay,
I think
great.
so. Thank you, Natalie, because I did have that question too. And so from what you just said, let's just say someone wants to come into the CHW program and get that education. My battery's running low. I hope I don't cut off. If they're working, let's say they're working a job, they need to free up their Wednesdays so that they can attend those virtual classes. They don't have to like quit their job and be available Monday through Friday. Okay.
Correct.
Okay.
Yeah,
Thank
correct.
you.
And actually what we've found to be a really beautiful model in seeking out apprenticeship employer sites is working with people who are already working kind of in those sites that we would normally seek out an apprenticeship placement, but they don't have the certifications and they want to grow in the work that they can offer at that employer. And so looking at people who are already working in social service providers or rehabilitation homes, and offering the training for them if their employer supports it to then allow them to be certified and offer higher level support and resources to the clients they serve. So yeah, they just have to have those Wednesdays available. We do require shadowing and some kind of outside work, but it's always flexible. So they're able to do that based on their availability.
Barbara, I would like to ask a question.
Yes, please.
Did we get anyone who would like to become an apprenticeship site for the Trauma-Informed Flourish Care Community Health Worker Apprenticeship? Because if you would, make sure you reach out so we can get you to become one of those employer sites. We would love to have you. We've had such great successes, great apprentices. Many of them are employed now at those sites and just would love to have that. This is a great way of being able to dip into the whole community health worker kind of world is through this apprenticeship approach.
And I
Emma,
had
I'm
some
really interested, but I want to talk it over with my CEO first to see, do we have what we need to have in order to make this a doable thing? So I'll probably be reaching out to get more information.
That's great.
And I wanted to add, sorry, that
that's okay.
VOA partners with you all, and one of my best CHWs has been there for 2 years, and I mean, amazing. And she's not going anywhere. She tries. we're gonna stop it, but
We love to hear
it's-
that.
yeah, she's amazing. She's amazing, and she came through you all. So thank you.
Oh, thank you.
Thank you. Thank you, Cheryl, for sharing that information. There's a question in the chat. It might be, I'm just going to warn our panelists, it might be a little too technical, but maybe you can give this individual a resource to help with it. When billing for an encounter, you must have a provider sign off for it. I am working for FQHC, and our pharmacy sometimes fills prescriptions for providers outside of the FQHC. How would we bill for the services outside of our clinic for our pharmacy patients when a clinical pharmacist isn't considered a provider? Is it possible?
Not everybody jump in at once.
That's a Laura question.
Go
Laura,
ahead,
and
Laura.
Joa, we may be able to tag team it. I'll let you start. I think I have my answer, but
Oh, I was
I've
gonna say,
been wrong many
y'all go
times.
first.
I would prefer
Chelsea.
the state to respond first, since it is a billing question.
Yeah. And my response is I will take that question directly to the Department for Medicaid Services. To give you the best answer. Johnny, it's Johnny. Hi, Johnny. I'm gonna take that to Medicaid for you. Would be my answer because I don't want to get that wrong.
Yeah. It's a good question though. So thanks for asking it. You know, now that we're able to bill for community health work, Medicaid and Medicare, you know, the nuances of billing are always fun as well as challenging. So thanks for that question. There may be other billing questions. I'm going to wrap this up in a little bit. I'm going to ask, unless I have any other, I don't have any other questions in the chat. I'm going to ask sort of like a final roundup question that would love to hear from all of our panelists. And we can go in order with Laura, Joa, Natalie, Tameka, Jennifer, and Pam. That's the order of my list. That's not the order you all presented. But my final question is sort of a twofold question. As we look ahead, you know, I've been in the field of social human services for well over, pretty soon I'm going to have to say almost 50 years, but community health work has been around for a very long time, even before, you know, it was regulated, was certified, et cetera. We've had boots on the ground in the community. Sometimes Mona says faces in the places, people working one-on-one with our community members and helping them to connect to healthcare and resources, et cetera. Some called community health workers, some called other things, but this particular profession has been around for a very, very long time, even in Kentucky. But now that we have this really wonderful opportunity, you know, as we look ahead, what are the emerging trends and innovations in community health work? And how can this role of community health work evolve to meet the changing and challenging needs of our communities of public health? So kind of twofold, you know, trends, and then how are we going to address and deal with the challenges?
Was my name first on that list?
Yes, it
The
was,
response?
Laura.
Y'all. All right. Okay. I'll go with just a few of the first things that came to mind. I mean, there are so many trends if we're talking, you know, on a national landscape. Some of the things that we're really focused on in these coming years is, and y'all are already doing this with Trager, is formalizing some of the career pathway. And we are focused, I know Trager is on our work group to create specialized certificates for certified CHWs. Long-term, we're also looking towards advanced certification options for CHWs in the state. Other states around the country are also kind of exploring this too. I do like to say Kentucky is ahead. So, you know, a point for Kentucky here. Those are some of the things that are really on our mind. I would say another trend is trying to align data collection across the state. So there's something called the National CHW Common Indicators. And one of our biggest focuses for the next few years is to try to align all CHW programs across the state with the same indicators. So collecting data and reporting data in the same way so that we can compare ourselves, Kentucky, to other states, on a national level. So those are some two big trends that we're seeing. And I would say, how can we, continue to respond to changes or issues? Many of you have heard the phrase, nothing about us without us. And we try to use that as our mantra, as our guiding, our North Star here at the Office of Community Health Workers. So continuing to make sure that the door and the dialogue is always open and that all the policies, big P policy or little P policy, programs, whatever, are actually guided by CHW voices in the state of Kentucky so that we're not moving forward things that nobody wants or asked for in the first place. So that's my biggest thing. I know we're not always perfect at it, but we're always striving to be better and to, use that as our guidepost. And so that's my best answer at that. And I forgot who was next on your list, so I'll pass it to whoever that was. Joe,
I
oh
have
shoot,
to-
sorry,
yeah.
Joe.
No, you're fine. I second what Laura says. She took my answer. We are really excited about this, the certificate program that is, in the very early stages, but we have heard a lot of CHWs wanting to further their training in different topics. And like Laura said, we're here to serve them. We want to do what they are needing and wanting. So that is, so basically what Laura said, I'm just reiterating.
Thank you, Natalie.
Yeah, I think it is a problem to have Laura go first because then what do you add to that, But I can't really speak to the specific needs, and I think Laura answered that really well already. But what I will say is that the field of community health work is inherently adaptive. And so really, because those are people who are coming from communities and serving their communities, we're already seeing that they constantly adapt to new resources, new needs. They're always looking for creative ways to meet the needs of their clients and their communities. And so really, they're not kind of set in the structured or rigid ways of many other care providers, who are kind of tied into specific models. Community health workers are able to adapt and be flexible. And that's, I think, one of the big draws of community health workers and what they do. So that's what I'll say in terms of how they adapt to seeing new needs.
Thank you. All right, Tameka, your closing remarks.
Yes, ma'am. How I have adapted, I'm not gonna go on with the long drawn story. I made this choice of becoming a CHW with my own trauma. Also giving back and putting myself in someone else's shoes, listening. That's what they want us to do. They want to be heard. They want their voices to be heard and understand. So it's my job to reach out and provide them with all the resources and advocate for them when they can't. I don't have the knowledge to do so, especially all of them are a passion and a heart to me. However, I like the challenge with immigrants because what would I do? How would I be, in their country or, not knowing anything, not speaking their language. So I have to give them more love, more support.
Thank you very much. Wow. Ooh, that, to me, I just want you to know that your last statement, all of what you said gave me chills, but what you just said about, working with immigrants, et cetera, is so important, but I can feel and sense your passion there too. All right, Jennifer.
It's kind of hard to piggyback off of Natalie and the ways that, our community health workers, they come in without lived experience and they have knowledge that Tameka probably knows more than I know. and I have a master's degree in social work. So I'm just appreciative of that partnership that we have together, that we can collaborate. And whenever I am struggling for a resource, Tameka's there to help me, find that resource. So.
Right. Thank you. And Jennifer, I appreciate so much that you spoke about this relationship as a partnership. That's pretty powerful, and I really appreciate that that use of words, etc. All right, Pam, you're going to wrap it up with our panel. And after Pam wraps it up, we're going to give it back over to Pam, I think. We're going to give it back over to Pam. Thank you.
Well, this was a great panel, and I think that, the community health worker profession is part of this movement towards maybe a compassionate culture. Let's lean into that. And I think that, as you were saying, what's the trends? Yeah, the trends are all about trying to walk the walk with someone, as they're struggling through all the various things that they're struggling with. Laura and everyone else was talking about career ladders and moving into that geriatric specialist. There's big movement towards focusing on lifestyle medicine and lifestyle in general, and our behaviors and brain health in particular, and caregivers, and how can we help those individuals, as the demographics are changing and more older adults, 1 in 4 by 2030. So there's also this billing, codes are very exciting, Medicaid, then Medicare, and movement into the Medicare Advantage space. So, and there's also more movement towards the digital health. So maybe community health workers too can help in that space, getting people a little bit more aware of that. So I am going to say, am I closing this out?
Next slide, if Justin can put it up. I forgot about this until I looked at Justin's face. The Optimal Aging Conference, Trager has been doing this conference for several years now, in partnership with the Kentucky Association for Gerontology. It's Optimal Aging Conference. Since COVID, we've been virtual. This year in April 20th through the 23rd, we're going to be face-to-face at the Brown Hotel. And this is important to announce here because for a host of reasons. Obviously, we have a variety of professionals here. We want you to know about this very important and conference that really does cover a lot of knowledge and information. But this year, we're going to have a community health worker track. And we definitely want our community health workers to attend. And we're going to have an announcement out hopefully within the next week or two, announcing a scholarship opportunity for community health workers. So if you employ community health workers, be looking out for this information. If you are a community health worker, be looking out for this information because we want to make every means that we can to get community health workers there, but we also want your employers to support your opportunity to come to this conference. So thank you. Now, next, Justin or Pam.
Okay. You want to do it, Justin, or you want me?
Sure. Sorry, I just lost my voice. Thank you, everyone. Please, we really appreciate if you would complete today's session survey. If you need a certificate or you're a community health worker seeking continuing education, you must complete the survey. So I just put the link in the chat, and there's a QR code here. I hope you will join us on March 15th. We have a really excellent session focused on food insecurity that you don't want to miss. And we have some great sessions the rest of the spring. So please complete your session survey. Again, the link is in the chat, or you can use the QR code, and I will put up our calendar of the next upcoming episode or episodes. It feels like an episode. Otherwise, have a great rest of your day, and we hope to see you next time.
Thank you, everyone, for coming.
Thank you, everybody.